Doctors, medical examiners, and morticians, what is the weirdest anomaly you've ever found on or in a body? One of our cadavers had 2 spinal cords, aka split spinal cord malformation. Edit. Just a first-year med student here, folks. Unfortunately, it's against our school's policy for me to even take photographs, let alone share them. One of our groups during our laminectomy, removing the back of your vertebra to expose spinal cord, lab, once they cut into the dura mater, the tissue that wraps around the spinal cord, noticed a split cord in the thoracolumbar region side by side. Our lead anatomist was very excited to see this and had the whole class come see. Apparently it's not the most incredibly rare thing, but it is the weirdest anomaly I've seen thus far. Story 2. She isn't dead, but this week I saw a patient with endometriosis in her lungs. Somehow womb lining cells had traveled up to her thorax and colonized on the lung. She previously had symptoms of coughing up blood while menstruating, but because the endometriosis was so severe, was on the pill to stop her periods entirely. Then she came off it to have a baby, and after the birth, with her hormones all over the place, she developed 2 pulmonary embolisms, blood clots in the lung, and a few weeks after that, 3 successive pneumothorax, collapsed lungs. The womb cells had tried to shed and made a hole between the airways and the sac surrounding the lungs, letting air escape. She's deciding now whether to let the surgeons cut out the part of her lung with the endometrial cells, to go back on the pill for life, or to have a full hysterectomy and remove her ovaries. Tough choice at 32. I've heard horror stories about endometriosis when it's where it's supposed to be. In the lungs? You can get that in the lungs? Or at least she can. I am so sorry. Story 3. I worked in medicine as an x-ray tech/medical assistant. One day we had a patient come in complaining of a stomach ache. Considering the time of the year, it wasn't abnormal. So we run him through the normal test urinalysis and an abdominal x-ray. KUB for those medically inclined. Well, he was a shorter fella, so I had a lot of room on the film. This kind of x-ray is one large shot centered on your belly button. It's mostly used to see how full of crap you are. I went to the dark room to process his film when something weird could be seen near his butt. There was a lot of crap backed up, but I couldn't tell what was causing the blockage. I showed the doc the film and she bust out laughing. The doctor I worked with was usually stone-faced and serious about these kinds of things, so it was odd. We were all confused. She asked me to go into the room with her while she asked him some questions. The first thing she asked him was what he shoved up his butt. I was so taken aback by this statement I almost missed what he said. You see, this 40-year-old man had diarrhea the week before and decided to shove a tampon up his butt to stop it. He tried to take it out, but the string got caught, and then he simply forgot about it. We had to remove it, and yeah, it was disgusting. I never did another procedure again. Story 4. Guy came in for an outpatient MRI of his cervical spine. On the form where it asks if he ever had any metal in his body, specifically asks if injured by a metal object, he selected no. Same with a verbal questionnaire. Also, we do a keyword search in the patient's heart chart for the term foreign body, in case it's documented. Nothing came up. He lays down, and I start taking images while talking to him through the speaker. During one of the image sets, he starts pounding on the inside of the scanner and screaming. I figured he was claustrophobic, so I stopped the machine and let him out. Immediately, he jumps up and starts talking nonsense and runs into the wall, screaming he needs to get away from the ocean. I call overhead for emergency room staff to come down and security as he's flailing. He continues to scream and runs into the wall before we restrained him. The staff rush down, and he's talking a mile a minute, explaining how he's inside of the poster of the beach that covers the entire wall in the room he's in. He's scared out of his mind and hallucinating. Security restrains him and he's taken down to get an x-ray of his skull. There was a BB in his frontal lobe. It had just enough ferrous metal left in it to travel a few millimeters in his brain. In the emergency department, he kept trying to escape and was very fast. While unrestrained, he got up, somehow convinced the guard he was better. Patient bolted out of his room into the main hallway. A code was called for a lost patient. For over an hour, nobody could find him, until a nurse looked into a large storage closet. Poor guy was found in a pool of blood. He crashed into a large mirror that was leaning on the wall and had severe lacerations of his neck, face, and arms. Efforts were made to transfuse him, but it was too late. Still haunts me how a simple BB from 40 years earlier could do that. Discovered his brother accidentally shot him with a BB gun when they were kids. Okay, if I said BB weird in that story, it's because I didn't realize he meant BB gun. I thought BB was a medical term that OP didn't explain. I was gonna look it up and whatever. Then the last sentence hit. Yeah, that makes more sense. Story 5. One of her patients, an older man with a Down syndrome, among other diagnoses, appeared to have extreme abdominal pains that lasted for weeks. They did several tests and tried some medication, but the pain wouldn't stop. He also suffered from constipation and stopped eating altogether at some point. The source of his troubles remained a mystery for almost 2 weeks, and the doctors were starting to get desperate. Then suddenly, one afternoon, my boyfriend's mom got a call from her clinic. She's the head of the department, so they let her know when something important happens while she's not on duty, saying this man had finally been able to go to the toilet, and among some stool was a blue latex glove. Over the following days, he passed about 20 of these in total, and he felt better and better. Luckily, started eating again. Most likely, he had somehow been able to steal the gloves from the cleaning lady's cart and ate them without anybody knowing or seeing, causing the gloves to get stuck in his intestine while absorbing his digested food, filling up like a little poop balloon in his stomach. This really is one of the weirdest stories I've ever heard, but my boyfriend's mom said he had been known for eating weird stuff, like one time he ate a t-shirt. Story 6. Not a doctor. I have a friend who has an amazing medical history. 3 types of DNA malformations. He was conceived in his mother's second, much smaller womb. His mother didn't know until she was almost a dude because the womb had nowhere to expand. His ligament on his left leg wrapped around his calf instead of going down to his toes. His left foot has 2 distinct forms of clubfoot. He has spina bifida, he has Klinefelter's, he isn't XX female or XY male. He was born with an extra vestigial kidney, the stuff that protects your spine. His is 10 times stronger due to his weird DNA. He's missing a vertebrae. He had an experimental spinal surgery, which was only tried 7 or 8 times/cases. He was the only one to walk afterwards. He was given shots of testosterone as a teen to make him have a male puberty. Now, many years later, this has given him prostate cancer. Testosterone blockers have now meant his Klinefelter's has decided he's a woman, and he now has breasts. He's okay with this since he's a magician that also does bearded lady gigs. There's probably more to his medical history, but that's all I can genuinely remember right now. He has been to patient-doctor soirees where he walks around talking to doctors about how his existence disproves their medical theorems. This is an insane existence. Like, this dude might be the most biologically unique person on Earth. If it didn't come with all the suffering that I'm sure came with it, I bet it would be really cool. And it sounds like he's making the most of it at least. Story 7. About a decade ago, I was doing a ride-along with a local paramedic EMS crew to recertify my EMT license. We got a call for transport from the hospital and directions to swap rigs to the bariatric bus. Driver calls on the phone to get more details and keep chatter off the radio. We have a patient being discharged from the ER who is too obese to be taken home via any other readily available transport. Yay, a big fat guy. This will make a great story later, right? We get to the hospital and the paramedic goes in with the supervisor, while the driver and I swap rigs with the guy who brought the bariatric bus. Pretty similar to a typical box ambulance with better suspension, a lower deck height, a wider patient area, a stowable ramp, and a worn winch, like on your buddy's Jeep, up front to pull the patient in on the gurney. We wander into the ER curious about the holdup, and wait near the nurse's station nearest his curtain. He's big, maybe 450 to 500 pounds, but surprisingly ambulatory, or at least standing. We are getting disappointed, thinking we were getting a 600-pound dude and a great story to tell. As the nurses finish up with him, everyone starts to prepare to get the big fella on the super gurney for the ride back home. And then he turned around, with the poor, undersized hospital gown hopelessly wide open in the back. What the hell is that between his legs? It looked like 2 watermelon-sized fleshy cysts hanging down between his legs. I looked at the driver and said, "He's going home with tumors on his crotch?" The driver looks at me and chuckles. He simply said, "Not tumors." It took me a moment to realize those were his testicles. Elephantiasis of the testes. I still can't unsee it, and I've seen all manner of gruesome road accidents over the years. This was the one that haunts me. Do yourself a favor and don't Google it. You're welcome. Story 8. Not a physician yet, but my mom was in the hospital. She had a horrible reaction to 5-FU, chemotherapy for colorectal cancer. She became neutropenic, extremely weak, slowly developed toxic metabolic encephalopathy with cerebral edema and posterior reversible encephalopathy syndrome. She had to be intubated and was at constant risk of infection. She was in and out of ICU for about 3 months. Complete crap show. And at the time I was getting ready for my first year of medical school, so this is my first taste of real clinical medicine. What's really nuts about this situation? Her immune system came back eventually. Brain swelling went down, and metabolically she was stable, but she was unresponsive. MRI didn't show any lesions or anything that would explain her neurological symptoms. After 2 weeks of her not being able to respond or move, her neurologist, off a hunch, did a test for myasthenia gravis, enacted something transferase levels, I believe, and came back with 4 times the normal amount, a very large result. Treatment was started and she was back to moving and talking, obviously needed intense rehab. What everyone thought was just a normal progression of having severe neurological problems was just an autoimmune disease that she didn't have before taking 5FU. Apparently, when your immune system comes back, it can come back abnormally and screw all kinds of stuff up. Scary 6 months, but made me realize doctors really know their crap, and they do so much for their patients. Gave me the extra motivation for school. Story 9. I used to teach human anatomy. Weirdest cadaver we ever had come in with cause of death listed as chronic obstructive pulmonary disorder. Very common for our cadavers. Once we opened him up, we discovered a lot of weird crap. We had a baseball-sized tumor right at the curve between his ascending and transverse colon, which screwed up both sections. His liver was malformed and tilted posteriorly. We never found his gallbladder, but there were still cystic ducts, so I'm not sure if the tumor wrapped around it or he's had it removed. He had a number of cysts on his kidneys, including one the size of an overfilled water balloon that was filled with a dark green fluid. The kicker, though, was a massive aneurysm at the end of the abdominal aorta. It was the size of a duck's egg. It was so big when I first saw it, I assumed it was a tumor on his spine, not an aneurysm. It was also full of plaque, like a centimeter thick on the entire arterial wall. The problem with getting cadavers for teaching is that we get a limited medical history. There was a lot of shrugging from me when my students asked why something looked weird. Story 10. Hamartoma on ovary filled with hair and mucus. Had a patient that had such bad nasal polyps that he hadn't breathed through his nose in 25 plus years. The polyps had deformed his nose to the point where he looked like he had a lion-like nose. It got to the point where he had polyps visibly dangling in his nose. Took 3 3-hour sessions with the roto-rooter just to open a passageway. Had a patient with a clouded over eye that stayed open when anesthetized. She was an addict, and the drug had taken a toll on her looks, and it was really creepy. Saw an emergency C-section during my rotations that really changed me as well. They went from having an intact mother to having a baby out in less than a minute. Blood everywhere. Had a guy that sucked on a metal bottle and stuck his tongue in it, and it got stuck and swollen up. We actually wrote up and presented the case as a study because of some interesting quirks we learned in the removal. Drained lots of gross stuff. Before med school, I interned with a physician at an Eastern medicine clinic in Mexico that did colonics. That was gross. People don't clean themselves well. Lots of corn came out of people, the drain tube was see-through, and you just don't know where to look. There's nowhere you want your eyes to rest. Especially don't look the patient in the eyes. Story 11. My husband worked reception at a local hospital a long time ago, and there were several notable patients, in part due to being the hospital that mental patients and prisoners from the local jail were taken to for medical issues. There was a frequent flyer mental patient that liked sticking things in his pee hole. He uncoiled a wire coat hanger and inserted the wire into himself. He had so much of the hanger in his body that it was all the way up into his bladder. Another time he came in, he'd inserted a stick from a tree in the most painful way possible. The forks in the branch were pointed towards him and not away from him, and it had broken into several smaller pieces during the process of insertion. He also liked pencils. There were 2 stories about women as well. One lady used a potato to pleasure herself, and a spud broke off inside her and took root. Potatoes like dark, moist areas to grow after all. She went to the hospital when she realized she had a vine growing out of her. The other lady went to the ER because she was embarrassed to go to her GP. She had this stench that was horrid, and no matter what she tried, she couldn't get it to go away. It turns out that she and her boyfriend liked food play, and about a month prior, he'd inserted cherries. The problem was he didn't count how many went in versus how many came back out. The smell was from forgotten cherries inside of her. The last one is kind of a legend in our city. Guy walked into the ER with a giant chef's knife sticking out of his head. Perfectly coherent, no altered mental state, but a lot of blood. His wife stabbed him in the head, and she did such a great job at it that she hit the gap between the 2 halves of his brain, somehow missing everything that could have caused the damage or ended him. He's actually known around our city now at the various hospitals, because he thinks that the world owes him painkillers due to that stabbing years ago. He's actually an entitled jerk who flat out demands attention when he walks into the ER, and sometimes even has the x-rays with him to brag about it. He's now divorced, and most medical professionals who have encountered him wish that his wife had worse or better aim. Story 12. Not a doctor, but my dad's story is too weird not to share. We were at the dentist getting our routine cleanings. Dad was the last to go, and apparently their sterilizer left the inspection mirror a bit loose in its housing. While looking at my dad's teeth, the mirror fell out and plopped in the back of his throat. Startled, he swallowed, and it was gone. The dentist freaked out, worried he might have breathed it in, and now has a piece of glass in his lung, so he sent us to the nearest hospital for x-rays. Knowing it's a weird situation, he wrote out a little note on office letterhead. We show up to the ER. Dad goes to the desk and says, "I was at the dentist and swallowed their mirror. I need a chest x-ray." And the nurse practically falls out of her chair laughing. He hands her the note from the dentist and she calmed down and handed him the paperwork. Eventually, they get around to giving him an x-ray and spot a nice round mirror in his stomach. They told him it would pass and just keep an eye out. At this point, we'd been there for 8 hours and the whole family heard about it. My aunts would pretend to check their makeup while staring at his stomach, and my uncles asked him if he had redecorated their bathroom every time he took a crap. He still hasn't lived it down. Yeah, I understand the dentist freaking out. Not only did you potentially cause serious harm to someone, but I'm sure what he was also thinking was, oh no, the medical liability. Glad all ended up well, though. Story 13. I work as an undertaker at a funeral home. I do embalming, cremation, and other typical funeral home things. One day we had a man, kind of overweight but not obese, come in, and the paramedics warn us, it's bad. We should be aware in advance of the severe injuries. I'm thinking, yeah, okay, I've seen it all. We pull back the sheet, and I almost passed out right there. He was a mess. This man obviously died a horrific death, and when we go to pick him up, he almost pulls in half. I guess we hadn't noticed from all the fat, but he was practically cut in half and had wooden fragments sticking out of him. There were guts and everything just spilling out along with the wood. We finally get him on the table, sew him up, embalm, etc., and we kept wondering, what is this wood? Finally, after what seemed like forever, we get him cleaned up and removed all the wood from him and put him in the morgue. After, we later find out that this man was in a horrific accident and had fallen over 15 plus feet into a wooden table, and somehow it cut him practically in two. My memory is a little hazy on what he fell from and what he was doing before he fell through. This was a little over 2 decades ago, back in 1998. I can't believe it. I got undertakered. I didn't see it coming at all. If anyone doesn't know what I'm talking about, you're probably so confused, but I don't know how to explain it. There was this guy on Reddit that went around commenting on literally everything with normal sounding responses, and then the end would always take with The Undertaker in Hell in the Cell 1998 plummeting through an announcer's table or something. I don't remember it verbatim, but that was the gist. Anyway, we got. Story 14. Radiologist working with ER imaging here. I've seen plenty of weird stuff. Prison inmates fight. One comes over with a toothbrush sticked all the way into his ear. Girl arrives walking and complaining of being shot in the head. Small wound at the back of her head, bloodied hair, normal neurological tests. Turns out she was really shot, and the bullet transversed her cerebellum and stopped at the temporal bone. Girl with psychiatric condition eats any small object near her. We have at least 24 different exams of her. One time, she ate 3 pencils and a screw. Endoscopist found 2 pencils in her stomach and a lesion on her esophagus. The 3rd pencil penetrated the esophagus wall and was stuck there. 7th floor fall with broken legs and nothing more. Old man with a jaundice. MRI was inconclusive due to metal artifact. He reported being shot in the belly when young, but doctors removed the bullet. An X-ray and an old-school cholangiogram showed a fragment of the bullet in main bile duct, probably migrated after years. Lots of weird malformation on stillborns and newborns. And this isn't surprising for doctors, but had a 16-year-old girl undergo MRI due to absence of menstruation. She had testicles instead of ovaries, called androgen insensitivity syndrome or Morris syndrome. That's just off the top of my head. I wish I could travel back in time and tell younger me, your job is gonna be awesome. Don't worry about the endless study hours. ER imaging is that cool. Story 15. Not me, but my mom is a nurse. So they had a guy come in for abdominal pain, actually unrelated to what they found, with a button on the outside of his intestines just chilling between muscles. So they take the freaking x-ray machine because the guy's never had a surgery in his life. No tears in intestines or stomach, nothing wrong with it, no button in the thing, but then they use a different one. Same freaking thing. Now they had a non-functioning x-ray machine and several upset x-ray techs. The kicker? It looked exactly like a doctor's button. He claimed to have never ate one. There was no entry wound, no scars to do a surgery, and for it to be between muscle, it would scar. They go back and recheck his file. Even called a few people to make sure he didn't have memory issues. Guy gave consent. Actually called a few people for the doc that weren't in contact because he was freaking out over this damn button. I'll say no, never had a surgery, never been in a serious wreck. He calls his mom and she never recalls him eating a button, and neither does his dad. We still have no clue what the hell it was doing there, or more importantly, how it got there. A tear large enough for a button in the intestinal wall would be difficult to heal and probably hurt, but I don't know. You know, I always thought Benjamin Button was some other medical thing. In all seriousness, though, I have no idea how that could happen. There would have to be some point of entry, and surely doctors checked everything. Do you think a magician screwed up? Like they're trying to do the behind your ear thing and then they just lost it? And that's when they realized that they really could do magic? It's the most probable explanation I can think of. Anyway, that's the last story for today. I'd like to thank you all so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.